Let me ask you, do you feel like you're worthless? Do you sit around thinking that the world would be better off without you? Have you lost interest in things that you once enjoyed? Do you have suicidal thoughts? I personally have dealt with depression. I have family that have dealt with depression. I have friends that have dealt with depression, and I've even lost loved ones and friends that have had depression, suicide to be exact. So my research that I did for this speech and also personal experiences is where most of my information comes from. There's words that you may not be familiar with, like cognitive behavioral therapy, which is just a type of therapy that's aimed at improving mental health. Hormonal disorders, which is just a condition that affects the endocrine system, like childbirth, menopause, thyroid disorder. And I have electroconvulsive therapy, which is a psychiatric treatment in which seizures in the brain are electrically induced to provide relief from that mental disorder. And it's only used with people who are very suicidal or the medication's not effective. I want to discuss with you what depression is, risk factors and causes, and even symptoms and treatments of depression. Now, depression is a mood disorder that causes distressing symptoms that affect how you feel, think, and handle daily activities. It's characterized by low mood, sadness, low worth. It affects every individual differently, and you have to have at least 2 weeks of symptoms to even be diagnosed with depression. According to Nancy Schimmelfing from verywellmind.com, risk factors can be related to personal or family history, any major life change, trauma or stress, and medications that you take for another disorder like blood pressure medications or anti-obesity medications. Even birth controls can be a risk factor for depression. Other risk factors would be things like physical illnesses like heart attack, stroke, cancer, chronic pain can be a risk factor. Causes, they range from genetics, poor nutrition, loss of a loved one, money problems, or drugs, or just anything in that category. Now, according to Felix Torres from psychiatry.org, symptoms vary, but the classic symptoms is long-term persistent feeling of sadness. There's other symptoms like being tired all the time. You have no energy to get anything done. It's difficult for you to make just basic decisions. You have no appetite. You may lose sex drive, and you may be thinking about or just planning a suicide. There's treatments that range from things like medications, antidepressants to be exact, electroconvulsive therapy, cognitive behavioral therapy, and there's other things that they can do that can be added to kind of help the symptoms that I just named, like yoga, music, exercise, traveling could even help. You can also figure out what type of vitamins to take as well to go in with just those other treatments. Now, depression is a serious disorder, but there's help out there. It takes proper diagnoses and treatment, especially finding a treatment that's best for you. If you or someone you know is dealing with depression and don't know where or how to seek help, please seek that help from your primary care physician or reach out to a psychiatrist, or even a loved one may be able to help get you the help that you need. There's also a statewide crisis hotline for the state of Tennessee, according to Department of Mental Health and Substance Abuse, and that phone number is 1-855-274-7471. And you can also text capital T, capital N to 741-741. I hope this information helps somebody. Thank you.